so without further ado, let's put our hands together and welcome Dr. James all the way from United States.
Hello.
Welcome.
Welcome. So, listen, guys. I have a question for you. Right? As pet parents, how many of you are worried that you're missing something in your pet's life? Right? As parents, do you worry that you're missing out or you're not giving something that they need, right, to keep them healthy? Does anybody worry about that as parents? I worry about it with my kids, my human kids and my dog kids. I want to make sure as a parent that I'm not missing something, right? So in order to not miss something, I have to make sure that I'm covering all of my bases, right? I'm taking into consideration all of the pieces. So that's what we're going to discuss today, right? Is breeds have needs, and how do we actually tailor their nutrition for their best health, right? Every one of us, including all of our dogs, are incredibly unique, right? You're unique, totally different than me, right? I'm totally different than you. We have different needs. So, did you know that the AKC, right? There are 201 different breeds of dogs that are out there. There are sporting breeds, hound groups, working groups, terrier groups. And inside of all of those, right, they're all incredibly individual, unique breeds. But yet each individual inside of that breed is unique in and of itself, right? What people don't realize is that inside of those 201 breeds, 99.9% of every dog that exists is a wolf. It has the same DNA as a wolf does, right? So, I'm Dr. James. I've been practicing for 20 years. I became CEO of Kala Health about 18 years ago. And I just wanted to put up that I have three passions. So my first passion is to educate. I think the world of nutrition and health can be overwhelming and super complicated for pet parents. And I think it's incredibly important that as a healthcare provider and advisor, that I simplify it. Because if I can simplify it and you can embrace it, then we can make change, right? The second thing is to create. We love research, developing unique raw materials that exist out in the world, and bringing those into pets' lives. And to serve. I still practice 2 days a week. I never want to lose touch with my own patients and the industry, so it's important to me to serve them. And I have my little tribe of crazy pet parents that I love seeing every day, right? It's an amazing profession. So my goal for you today is to teach you, number one, how I think about practice and what we do in our practice. We have a very unique practice. It's very different than the traditional animal hospital. I'm not holistic or all natural. I incorporate both Western and Eastern medicines, but we think about the individual as one whole piece. Two, I want you to just open your minds a tiny little bit and think outside of the box so that I can empower you and potentially you can have different conversations with your doctors. And three, hopefully we discover if there's any missing gaps, then we can fill in those gaps so you don't have FOMO. The Western veterinarians, what they're trained to be is surgeons, anesthesiologists, dentists, right? They're taught to be disease hunters and then managers of disease. That is not a preventative, proactive wellness approach. So I put this up because my dream come true for both my own doctor and I don't know if everybody, I have a Western doctor and I have an Eastern doctor, right? I have a naturopath and I have a Western trained doctor. And I use the advice from them, you know, and figure out what's going to be the best solution for myself. So my dream come true is that our doctors would be focused on prevention and a proactive, tailored plan for myself and for my animals. And of course, they would be great surgeons and disease hunters and managers. So in our practice, we have this philosophy where we meet the pet parent where they're at, right? Because every dog is unique and every family is unique. That pet parent, everybody's different. Some of them have a lot of money and can do anything. Some of them don't have any money, and we have to tailor our approach, uniquely to them. So, in life, there are things that we can control and things that we can't control, right? There's things that we can. An example of something that we can control is the food, obviously, and the nutrition I put into my kids' bowl. I can make time for them, or I could not make time for them. I could take them for a walk, or could not take them for a walk. In the little dogs, right? A lot of them have knee problems and back problems. I could make sure that my dog doesn't jump on and off my bed, right? Because usually beds are really high, and that would be, for example, I'm almost 6 feet, right? If you think of like a toy poodle jumping off of a bed that's 3 feet, that would be me probably jumping off a 9-foot wall every day. Probably not going to be good for my skeletal structure. I'm probably going to end up having joint problems, right? Or back problems. And then there are things that we can't control. So we can't control their genetic makeup, right? Their DNA is unique to their parents and the lineage that's there. I can't control the weather, right? I live in New England in the United States. We have 4 seasons. You have 1, right? It's hot, it's humid. The environment, I have no control over it, but I can respond to it, right? So you have in your hands that sheet that are the 4 quadrants, and I just want to go through and kind of walk through each one of them. And what I would like to do, or if you would like to do it, if you fill it out for your dog at home, come join me afterwards and I can go through each one of them and we can talk about if there is anything that you could possibly adjust or fix, whether it's core nutrition or supplementation, okay? So, the 4 categories. Breeds have needs. We can't control them. We said that, right? Your pet's unique life. So, can't control the weather, but I can control the home environment. Their core nutrition, I have total control over what I end up feeding them, and then we can control filling in the gaps. So let's talk about genetic predispositions. There is documented genetic predispositions probably over the last 50 to 100 years where we know what diseases exist throughout that genetic profile. It's very common now for people, I know you have purebreds, but you can go and get a genetic test and they will scan through 350 potential genetic predispositions, so you can actually find out if your dog has that genetic profile, and then we could respond to it. So let's go through a couple of these. So we have French Bulldogs. I think there's more and more of those that we're seeing now. Last year I didn't see as many of them, but now I see lots of French Bulldogs, Corgis, Toy Poodles, Pomeranians. If you notice, does anybody know what IVDD stands for? Back, right. So that's intervertebral disc disease, right? So again, French Bulldogs have a problem called hemivertebrae genetically. Respond. Don't let that dog jump on and off a bed. If they have that genetic predisposition, they're probably going to have, it's like a weak link in the chain, right? The same thing goes for, let's say, a toy poodle. There's lots of those walking around. So tracheal collapse, for example, that's very closely tied to weight management. do not let your dog get overweight if you have that breed and that genetic predisposition. Patellar luxation. We sell a lot of joint nutrition to those dogs because they genetically have kneecaps that pop in and out. They have 4 different grades of them. Anyway, we can talk about that. So let's go into some of the large breeds. What I suggested to people yesterday was you can go on ChatGPT, you could go on Google, it's more of a pain in the neck, but you could go on ChatGPT and say, what's the genetic predisposition of my breed, right? And get the list. So familiarize yourself. Then you ask it, hey, explain that to me so that I know, right? You need to know that data so you can respond to it. So let's talk about golden retrievers, Labrador retrievers, huskies, lots of huskies here, lots of goldens. If you notice, they have lots of joint problems, right? Elbow dysplasia, hip dysplasia. A lot of them tear their ACLs, muscle dystrophy. So these are all things that we can nutritionally respond to. And the earlier you respond to it, not being reactive. Oh, my dog is only 7 years old, so I'm not going to give them any nutritional supplements. So we wait until they're 11, and that disease has already progressed. We have to get out of a reactive mindset and enter into a proactive mindset, right? So we have your pet's unique life experience. The different stages of their lives require different nutritional demands, right? We need to think about that and then respond to it. The home environment. A couple days ago, I was talking to somebody whose dog was a poodle, and they had linoleum flooring, and the dog had patellar luxation, had patellar problems. And she noticed that the dog was slipping, which was aggravating that problem. So she responded. She put little runners for the dog to track around the house. And it was a huge improvement. And the dog knows because they feel the world through their pads, right? Keeping their nails short would be a response. With the long nails, that's not good for their gripping the environment. So lifestyle. Do you have an active dog? Do you have a mildly active dog? Or do you have a not really active dog, right? The couch potato. I call them domestic slugs, but they're couch potatoes. And then lastly is the personality types. Are they outgoing? Do they love other dogs, but they don't like people? Do they like people and don't like dogs? These are all things that, whether we respond to them or not, the concept is to bring it all together so that we can have more intentional conversations about that child's unique needs, right? So core nutrition. How many of you are feeding 100% dried kibble diets? 100% dry kibble? Okay. How many are feeding like a mix of dry kibble and canned foods? You doing canned foods? Okay. And then who's doing all raw? All raw? Doing a mix of raw and dry kibble? So these different core nutritional profiles we then can respond to, right? And we can add accessory nutrients that will make it a more whole approach, right, to their health. How many times a day are you feeding? Are you feeding once a day, twice a day, 3 times a day? A puppy, right, should be eating 3 or 4 times a day. Whereas an older dog might not need that, right, as they're not moving around as much. Maybe I do 1 meal a day, maybe I do 2 smaller meals a day, right? As they don't move around, maybe I have to reduce their caloric intake because they're not expending that calories. So dietary personality. Who has a picky dog? Anybody have picky dogs? Picky dog. I want to talk to picky dog people later. Picky dogs are tricky because sometimes they're picky in its behavior. One lady yesterday, I had her come up afterwards and I had her fill out the sheet. And then I realized that she was giving her dog whatever the dog wanted. If the dog didn't like it, She would go back, prepare something else, give it to the dog. I said, your dog's picky because it's just holding out for you to create something that it likes today, right? Sometimes I want Mexican food, right? Sometimes I want Vietnamese food. It doesn't, like, you can't do that with dogs because you'll create behavioral challenges, right? So just another thing to take into consideration. There are other dogs that will eat anything, right? That's a whole problem in itself. So how about with extra goodies? Are you guys big treaters? Do you give lots of treats? Some people don't give any treats. They say, no, I don't give my dog people food. I had a lot of people say this. I don't give my dog people food. As in, people food is different than dog food. So I wrote this book. It was called Dogs Don't Cry. And I made this point because they wore it as a badge of honor. I said, I have traveled across the United States multiple times and I still don't know where the dog food fields are. As in there was something wrong with people food, right? So anyway, and then water consumption. Big water drinkers, little water drinkers. For the people that do dry food, are you putting water in the bowl? So that's the big deal, right? So dogs have no digestive enzymes in their mouth, right? They don't chew food like we do. We chew our food and we have two digestive enzymes that are in our saliva, amylase and lipase, right? To break down fats and starches. Dogs don't have that. They gulp their food. So digestion starts in their gut. By wetting that food, you will help them extract the nutrients easier. So you want to add water to the food. If you're doing raw-based nutrition, that might be different, right? Because it has a lot more water content to it. So then we fill in the gaps, right? So this is where we take a step back and we ask ourselves, do we have all our bases covered in terms of core nutrition, right? Are there cleaner, better treats that we could use? Could we actually be using a better core nutrition? I put this down, it says the formula is one thing, but the quality of the nutrients is everything, right? The quality of the nutrients is so important. You can look at labels. Duck is not duck, right? Chicken is not chicken. The quality of that protein matters. You could have chicken that's pumped with hormones, right? And pumped with antibiotics in order to get that chicken to grow faster and bigger. But that's all passing through into your core nutrition. So we have to take that into consideration. And then I just said that branded ingredients matter. Does that mean anything to you, right? Branded ingredients just means that the raw manufacturer of that ingredient has taken the time, the energy, and the investment into making sure that it's the best of the best, right? So branded ingredients are a big deal when it comes to core nutrition or to supplementation. The last thing I wanted to leave you with was in Finland, there is the University of Helsinki, all right? And they have a vet school there. And for the last 20 years, they've been doing research on raw-based nutrition. And they showed in this study that they published in 2021 that just simply incorporating 20% of your core nutrition, right? So the total daily calories for the day, if I take 20% of that and I put that in raw, that the dogs will have a decreased prevalence of allergies, atopy, skin conditions, and are overall just healthier dogs. Do you know why? Because it improves the gut microbiome, right? And that raw nutrition has far more micronutrients, whereas like in the dry food profile, the food is cooked at 425, and then they add synthetic or natural minerals and vitamins back. So they're just getting better nutrition and a more diverse profile. If you think about this, if this little child over here is 99.9% wolf in DNA, What wolves were eating food that was cooked at 425 degrees, right? It didn't happen. It became a convenience thing in the world. So if I can do anything, I would just like to get people to just add that little bit into their dogs' lives because it will make them healthier, all right? So if you take the time, if you want to go through the process, fill out the form. I'm going to be sitting over here and we can go through and talk about your child and I can get to know you and their environment. And then we can figure out if we can respond or tailor a better approach to their nutritional life. Okay?